Emphysema. Emphysema is a type of chronic obstructive pulmonary disease. Emphysema is a lung condition that develops over time and involves the gradual damage of lung tissue, specifically affects the air sacs in the lungs. Normally, these sacs are elastic or stretchy. When we breathe in, each air sac fills up with air, and when we breathe out, the air sacs deflate and the air goes out. With emphysema, lung tissue loses elasticity and the air sacs and alveoli in the lungs are damaged. When we exhale, the damaged alveoli don't work properly and old air becomes trapped, leaving no room for fresh oxygen rich air to enter. This means that there is a smaller surface area for the lungs to take oxygen into the blood and remove carbon dioxide from the body. Additionally, this blockage causes the lungs to slowly overfill and makes breathing increasingly more difficult. Emphysema is one of the two most common types of chronic obstructive pulmonary disease. The other major COPD condition is chronic bronchitis. Most people with COPD have both emphysema and chronic bronchitis, but how severe each type is can be different from person to person. Emphysema is an irreversible condition, so treatment aims to slow its progression and minimize symptoms. Causes. Pulmonary emphysema occurs very slowly over time. The cause of emphysema is usually long-term exposure to irritants that damage the lungs and the airways. Smoking tobacco is the leading cause of COPD. Men and women are at about an equal risk of getting the disease. Exposure to other inhaled irritants can contribute to emphysema. These include secondhand smoke, air pollution, and chemical fumes or dust from the environment or workplace. Frequent childhood respiratory infections, asthma. Rarely, emphysema is caused by an inherited deficiency of a protein that protects the elastic structures in the lungs, known as alpha 1 antitrypsin deficiency. Symptoms. Some people have emphysema for years without knowing it. Some of its first signs are shortness of breath and coughing. At first, a person may notice these symptoms during physical exertion. However, as the condition progresses, symptoms can also start to happen during rest. Other symptoms include a chronic cough that produces mucus, wheezing, and a whistling sound while breathing, frequent respiratory infections including acute bronchitis and pneumonia, tightness in the chest, reduced appetite and weight loss, barrel chest or overinflation of the lungs, bluish gray lips or fingernails from lack of oxygen, fatigue and a loss of energy, anxiety, depression, and sleep problems. Diagnosis. A doctor will ask about client's medical history and do a physical exam. He may also recommend tests to confirm the diagnosis and rule out other conditions. The tests include lung function tests, which measures how much air the client's lungs can hold and how well the air flows in and out of the lungs. Spirometry. A spirometer is a device used to check lung function. For this test, a person blows as fast and hard as they can into a tube. The tube is attached to a machine that measures the volume and speed of the air that they blow out. Peak flow monitoring. This device measures how fast a client can blow air out of his lungs. Sputum culture. A sputum culture is often used to see if an infection is present. Other tests include imaging such as a chest X-ray or CT scan to look at the lungs. Arterial blood gas analysis to assess oxygen exchange and carbon dioxide levels to determine how well the lungs are transferring oxygen. Pulse oximetry to measure the oxygen content of blood, and electrocardiogram. This test records the electrical activity of the heart, shows abnormal rhythms, and can help find heart muscle damage. Treatment. There is no cure for emphysema, but treatments can help relieve symptoms and slow the progression of the disease and prevent complications. Medications. Depending upon the severity of the symptoms, a doctor might suggest bronchodilators, corticosteroids, and antibiotics. Oxygen therapy may also be needed in severe cases. If it's severe emphysema and there is low levels of oxygen in the blood, oxygen therapy can help the client breathe better. Pulmonary Rehabilitation. A pulmonary rehabilitation program teaches breathing exercises and techniques that may help reduce breathlessness and improve quality of life. Nutrition therapy. People with emphysema are often underweight, hence, nutritional support is crucial. Alpha 1 antitrypsin replacement therapy, if needed. Surgery. Lung reduction surgery may be used to remove small parts of damaged lung, and a lung transplant can replace the entire lung. These are rare surgeries used only for people with severe emphysema. Lifestyle changes. If you or anyone who suffers from emphysema can take a number of steps to prevent its progression and to protect himself from complications. Quit or avoid smoking. If you are a smoker, this is the most important step you can take to treat emphysema. Since emphysema is mainly caused by smoking tobacco, the best way to prevent it is to refrain from smoking. Also, stay away from harmful chemicals and fumes and heavy pollution. As much as possible, avoid secondhand smoke. Do regular exercise. Following or developing a regular exercise program can strengthen the muscles that help you breathe and significantly increases your lung capacity. Practice diaphragmatic breathing, pursed lip breathing, and deep breathing. Protect yourself from cold air. During cold weather, wear a scarf or a mask over your mouth and nose before going outside to prevent the cold air entering your lungs. Eat healthy, balanced diet. Consuming a wholesome, healthy diet is important to meet your nutritional needs. Ask your healthcare provider for a diet plan that will meet your nutritional needs. Stay hydrated. Drink plenty of warm water to loosen mucus and help keep the airways open. Get recommended vaccinations. Getting the flu and pneumococcal vaccines can help prevent getting an infection. Avoid direct contact with people who have a cold or the flu. Coping and support. Emphysema can severely limit your ability to participate in daily activities. Express your feelings and don't be afraid to seek counseling if necessary. Joining a support group can help you connect with others who have the disease and share similar experiences. Outlook. Emphysema is one of the most preventable respiratory illnesses because it is so strongly linked to smoking. There is no cure for the disease and it gets worse with time, but you can slow its progression. Smoking speeds up the disease, so quitting is important. Seeking early treatment and taking measures to manage the condition can help enhance a person's health and well being and may improve their lifespan. Thank you.